With crisis standards of care now being used, this is a critical time for our hospitals. Today, our cameras were allowed a rare glimpse inside a hospital in crisis mode. CBS 2's Brent Hunsaker takes us inside St. Alphonsus and shows us staff and a hospital that's straining at its limits.
Hospitals are the key. I mean, ever since the beginning of this pandemic, Crush the Curve was about making sure that our hospitals weren't overwhelmed. And here we are a year and a half later in this pandemic, and our hospitals are closer than ever to being overwhelmed.
Through these doors is the first stop for COVID patients, the emergency department.
If they're in significant distress, we're going to take them back to our resuscitation rooms, and we're going to analyze and see what they need. And likely they're going to be hypoxic, which means they're not going to have enough oxygen. If they have an oxygen less than 90%, they're most likely going to have to stay in the hospital.
To handle all of the patients coming in, St. Alphonsus Emergency has taken over what was a storage room.
So now it's been rearranged, has curtains with tags for room numbers. We staff it with a nurse, two if possible. We don't always get that.
Converting spaces for patient care is a recurring theme. Up on 9 Central, one of 2 COVID wards, it's the rehab gym.
This is actually partitioned in half.
This doesn't look like a gym right now, though.
It doesn't. It's been repurposed towards acute patient care. We have curtains to divide the patient spaces, beds, tables, everything you'd expect for a normal patient room.
But Dr. Carolyn McFarlane points out that it's not just about space, but also staff.
So a bed in of itself doesn't save a patient. A nurse and a physician and a CNA, a respiratory therapist, all of these staff members, and there's just as much a shortage of staffing as there is of space.
COVID patients who don't respond well to treatments on 9 Central eventually end up here in the ICU.
If you're sick enough with COVID to meet me, you're in trouble.
This is the last stop.
Ages range from 29 all the way up to 60, but the majority of our patients right now in the ICU are young, in their 50s.
And that's different.
That's very different, this surge, compared to previous surges.
Why the difference? Why are so many patients younger? Well, frankly, it's because older people have done a better job vaccinating. And that weighs on the staff.
There's a degree of feeling demoralized because this is preventable at this point, right? Yeah, we have some breakthrough infections here in the hospital, but the large majority, greater than 90% of our COVID positive patients in the ICU have chosen not to get vaccinated. And that's hard. It's hard to take. It's hard to take when you're a nurse at the bedside, or a respiratory therapist at the bedside, or a physician, or a nurse practitioner, or physician assistant, any of us going into the room, seeing these patients, and then hearing the sobs of family members at the other end of the phone. And it's hard to not think it didn't have to be this way.
The emotion in the doctor's voice and the look in the eyes of staff reveal a growing stress over an expanding pandemic and the desperate attempt to keep up.
This area used to be post-op recovery for day surgeries, but within a matter of hours, if not days, it will be turned into a critical care unit. That's how quickly things are changing here at St. Alphonsus. Brent Hunsaker, CBS 2 News.